Hi travellers, welcome to Smart Traveller's Disease Guide video for malaria. My name is Nurse Judy. Today we will be discussing what malaria is, how it is spread, where you can get it, how you can prevent it, how it's diagnosed, and how it can be treated. Here are some things that you need to know about malaria. First off, malaria is the world's #1 most infectious disease. It is life-threatening. It is a parasitic blood disease transmitted by the bite of an infected Anopheles mosquito. It cannot be transmitted from person to person. This right here, as demonstrated by Nurse Diane, is an Anopheles mosquito. If you are traveling to Central African countries, Central and South America, parts of the Middle East, East Asia, and the Pacific Islands, you are in danger of contracting malaria. Your risk is increased if you are staying in rural areas, around wildlife and national parks, or staying in traditional mud hut-style buildings. Anyone can be infected by malaria if bitten by an Anopheles mosquito, but you should take particular care if you are traveling with infants and young children, or if you are pregnant, or have a suppressed immune system. Symptoms of malaria vary and take different amount of time to display themselves. Some symptoms include fever, headache, backache, nausea, vomiting, muscle and joint pain, sweats and chills, and in more severe cases, impaired consciousness, convulsions, respiratory distress, anemia, and jaundice. Early diagnosis for malaria is important to reduce the risk of spreading the disease and to prevent it worsening. Diagnosis should be done by a medical professional through the testing of blood. If diagnosed, malaria can be treated using specific doctor-assigned drug regimes known as artemisinin-based combination therapy. Malaria is preventable by using mosquito nets while you sleep, using insect repellent that contains DEET, such as Bushman's, taking antimalarial drugs, and wearing loose-fitting, long-sleeved, and loose-legged clothing. Examples of antimalarial drugs include chloroquine, malarone, doxycycline, proguanil, and Lariam. Talk to your doctor about which drug would suit you best. If you are in a malaria area, you should check yourself for mosquito bites. If you have a mosquito bite, seek medical attention within the following weeks, either when you return home or within the country you are staying. If you start to feel sick, let your doctor know that a mosquito bit you whilst you are traveling in a malaria area. Malaria can take up to a year to display symptoms. In many countries where malaria is a risk, control methods have been implemented to target the mosquitoes and assist rural populations where the disease has caused highest mortality rates. These include surveillance of the disease, whereby observing its spread, mutation, and evolution and trends, enabling health organizations to track the disease and see how and where it is spreading, and if it is evolving to resist treatments, and where resources are most usefully allocated. And elimination, whereby the effective detection, diagnosis, and treatment of all malaria cases, whilst also using plans to reduce mosquito populations. This involves education and community involvement in the form of educating local populations on how mosquito populations can be reduced or discouraged. This concludes our Smart Traveller's Guide to Malaria. Remember to be cautious and use preventative measures in order to avoid infection. If you have recently traveled to a malaria area and are experiencing any of the mentioned symptoms, please seek medical help from a professional. For more information, please contact 13Health or see our information pamphlet or visit your local doctor or the nearest public health unit.